Without any further delays, we would like to bring on our speaker, Dr. Roberts.
I am a urologist, and a urologist I consider to be the equivalent of the male gynecologist. And so our primary focus, I'm a surgeon, and with that, our primary focus is looking at diseases of the kidneys and the bladder that require surgery. But more importantly, we are the principal professionals concerned with the health and the welfare of the male reproductive system. And so over the past now approaching 40 years since I've been a specialist, looking at men's health and men's reproductive diseases as probably my specialty. So I feel very much at home. And I think the greatest joy of being at home is that I know Bahamian men. And that gives me a special interest. And I want to say a special joy in terms of looking after them. I can identify with them because I'm one of them. I was challenged to talk on men's health. And so what I really want to say then is more or less looking at men's health with regards to for better or for worse. And I want to start off this way. They can allow me to go? Yeah. So when we look at the stages in a man's life, from the time of our birth, and those where we get into middle age, and then hopefully in senior to be our senior citizen, we are extremely fortunate that, and we're being blessed with the oneness of modern medicine. It's very difficult for people to believe that for the past 10,000 years or so, long before Christ, that the average age of man was between 30 to 35 years. Very few lived to see 40. Now, yes, we look at Methuselah and people talk about living over 800 years, but the realities are, our science tells us, as we see in the time of Jesus Christ, that the average age right up to 1900 didn't improve much. As you can see in this basically flat line, that most of us would live to 35, but something happened in the 20th century. By the time we reached the year 2000, we had double the lifespan of man because of advances in modern technology, advances in pharmaceuticals, advances in better services provisions, specialization, and so forth, vaccinations. So we double the lifespan of man. So we're now seeing on average, as we in the Bahamas, the average age of our senior citizens going well into the 70s and 80s. The truth of the matter, though, is that when we reach the age of every Thursday, we get our newspaper, we look at the obituary column, and it's very clear that quite a number of us do not reach the C70. We are surprised to see how many young men don't reach the C even in their 50s. We also realize as we're getting old that there's so many things that we can't do like we used to one time ago. We yearn to see our children grow, and more importantly, we want to see our grandchildren grow and to graduate from school. But unfortunately, as too many of our young people, we see ending up in hospital with severe illnesses. And I'm reminded of the famous saying by the American business philosopher, take care of your body. It's the only place that we have to live. And so what I want to do over the next 20, 25 minutes is I want to take you with me through a series of 10 questions to look at the realities of a man and his physical and mental health with a focus on us in the Bahamas. And so here I want to start the first question. What is the state of man's health today in the Bahamas? Well, it is very clear that a lot of our men are not in good health. They are sicker than women, and we die at a younger age compared to our women. The data is very clear. When we compare ourselves with our female counterparts, we are more likely to have high blood pressures, more likely to have a high incidence of cancers, more likely to be alcoholic, we're more likely to be in prison and to be homeless, we're more likely to be engaged in illegal drugs, we're more likely to be involved in dangerous jobs and have more job facilities. And so it's not surprising that women outlive men by at least 5 years or more. I asked the second question. So how sick are we? And I want to tell you that in some instances we were sick. The last time, I just want to highlight one or two slides, the last time I gave a talk about prostate cancer. And I want to highlight very clearly when we look from a global perspective, it's one of my famous slides, from a global perspective of the mortality rates from men from prostate cancer, which we know prostate cancer is the number one most common cancer in men throughout the world, maybe only rivaled by lung cancer. But when it comes to deaths, we see that in the Caribbean, we have the world's highest incidence of mortality from prostate cancer. And that is because 70 to 80% of our men, when they present with prostate cancer for the first time, they present with advanced disease. I think I like this famous slide I had showed before, and this just goes to show you what I think of the disparity, that it's a little more than education. I think there's a culture. And of course, as you can see, there's also our genes. And we know that men, the incidence is very clear that men of African ancestry are 2 to 3 times more likely to have prostate cancer and to die from the disease. But here are a group of men, well educated, from the Caribbean, of Black ancestry. And on the first row, you'll be able to identify Bob Marley, Manley, Prime Minister of Jamaica. We have Lyndon, we have George Mackey, we have Sidney Poitier, we have Belafonte, we have Colin Powell. These are all men from the Caribbean who died from prostate, who were diagnosed with prostate cancer. On the top line, men full-time lived their life in the Caribbean. They all died because of advanced prostate cancer, as opposed to our men who from the Caribbean lived most of their lives in North America. They had their cancers detected early and died at a ripe old age with prostate cancer than because of prostate cancer. And that speaks volumes to our concerns about our health in our region. So we have to ask ourselves, can we do better? Well, we absolutely can do better with prostate cancer. And this is to show how we probably can do better in a lot of our cancers. So with the advent of the prostate-specific antigen, which is sort of like the equivalent of the mammogram or the pap test, where we can pick up disease at an early stage before it shows itself, and if so detected, we can even possibly cure the cancer. At least we have long-term survival and we die of something that's other than cancer. This showed that once they got into the screening program at a population basis, and the men adhered to getting their checkups and their PSAs, that within the first 10 years of the PSA screening, the mortality rate from prostate cancer decreased by 40%. In fact, today, the mortality rate from prostate cancer since PSA came into being is now approaching 50%. And what we can see in that same period in the Bahamas, that our mortality rate from prostate cancer didn't decrease. In fact, it increased over that period of time. And so we have to ask ourselves, so why is this? Why are we going against the grain? Well, as I showed in that earlier slide, if we come early, we can get rid of this disease. At least we can definitely control this disease and die from something else. And that is because we are not listening to the message. We're not adhering to the message that when we reach 40 years of age, when we are now become susceptible, we are in the at risk group, we are not getting our annual PSA checkup, and we are not getting a digital examination. I talked to the last time about the controversy of digital examination. Yes, the PSA is more superior, but at the end of the day, I feel this is a part of our total examination, and men need to appreciate that the exam in this area has more to do with our full checkup than just focusing on the prostate alone. The fact is the matter is that the men are not getting their checkups. I like to remind the women in the lecture at this point in time that we have a similar problem with women with regards to the women coming early to get their checkup in terms of the pap test. And they are neck and neck with the men, whereby despite the fact that in this day and age, no woman should die from cervical cancer, that cervical cancer remains our number 2, I think, cause of death in women, because women are not getting their annual pap test, just like the men are not getting their annual PSA blood test. So we have a problem across the country with regards to our awareness and our health-seeking behaviors. But this is the one which I really would like to focus on, because while we have those factors that make prostate cancer, as you can see in the African-American male, to be twice that of all ethnic groups, including the whites and Hispanics and so forth. So while it might be, we might die from prostate cancer 2 to 3 times more than our other ethnic counterparts, the truth of the matter is that when we look overall at the major causes of death in men over the age of 45, prostate cancer only accounts for some 3%. So 10 times more of our men are dying from heart disease. That's because of hypertension and diabetes and high cholesterol and obesity. So therefore, when we start to look at men's health, we have to realize where we get the best bang for our bucks. And those are the diseases that we need to concentrate on. And so when we look at our men's health, and we look and say, so what do we want them to do on their annual checkup? Yes, we want them to look at their blood pressures and their status for diabetes and the obesity and the cholesterol and their cancer checkup with regards to their prostate, with regards to getting their colon, with regards to their lungs. I didn't have on here and test this. Make sure in terms of cigarette smoking, looking at our alcohol intake. And so we know very clearly that, that the evidence is when we start to reach 40. You might get away with it in our first, and when we're in our 20s and 30s, that you might not need to get a checkup once every 5 years. There's a lot of debate going on now whether you need to have an annual checkup and who should you go to and so forth. But the fact of the matter is that when we reach over the age of 40, when our body no longer is a nice young body and we slowly start to go downhill, it is very important for us to have regular checkups. We know the data that with regards to which cancers requires which age. For example, we know the colon cancer, you should get a checkup every 10 years once you hit the age of 50. But we also know very clearly that if you have someone in your family that has colon cancer, you should start within your 40s, preferably no later than 45. And you might need to, if you find something abnormal, get it every 5 years. Okay, we know the fact that you avoid cigarette smoking as much as you can, even in secondhand smoking. So, we are quite aware of the things that we should be doing, and we'll come back to that later on. But this is what we consider in terms of looking at our annual checkup that we need to be concerned about. So we know we can do better, and we must. Now, we talked about those physical components of our body, but is this neglect of our healthcare men? Is this everywhere? Which is very interesting. It brings out another dimension of our manhood. And you would think that we like to think of ourselves as macho men. We like to brag about our sexual prowess, to how we can perform and how we like to be defined and how we would like to be thought of. So our potency, our ability to perform sexually, our ability to have a good erection should be paramount in what we're doing. Well, here are the facts. The facts are that when we look at erectile dysfunction, that is the ability of a man to have an erection, that what the studies have shown, and they've done quite a number of studies throughout the world, especially since Viagra came into being in 1998, that when a man reaches the age of 40, between 40 to 70 years of age, by the time he reaches in his mid-40s, 50% of men have a problem with an erection. A third of them will be about not bad. There's some that be in the middle. And then you have a portion where they have a complete dysfunction. They can't get an erection at all. Now, we know why. Diabetes affects it. Prostate disease affects it. Peripheral vascular disease affects it. Cardiac problems, cholesterol, high blood pressure. Why? Because getting an erection is all about blood flow. All about blood flow. And for how blood flows in the penis through the blood vessels. And so in order to get a good erection, you must have good, healthy blood vessels, and you must have a good pressure in the blood vessels in order for the erection to occur. Well, quite simple then. Anything that affects the blood vessel, that damages the blood vessels, that disrupts them, that obstructs them, so the blood can't flow or drop the blood pressure, then you'll have problems with erection. Well, we know the prevalence of diabetes, particularly as you get older. I think the evidence is that you're 4 times more likely if you're diabetic to have problems. We also know that when you start to reach the age of, I think it's like 1 in 6 men in their 40s or 50s, they have a problem with diabetes, or almost the same, have a problem with high blood pressure. They are prominent in our countries. So if you have these conditions, we know the men who lose their legs, and they lose their legs because no blood flows to the legs. We know how prevalent it is to have heart attacks. It's amazing how we see men just falling down, and 50% of myocardial infarctions or heart attacks are fatal on first presentation. We know the amount of people who get strokes because of blood flow. The blood flow clogs up or ruptures. We know the high prevalence of people who go in kidney failure because of impaired blood flow. So that's why they call high blood pressure the silent killer. because it damages blood vessels. That's why we call diabetes when we see all the men who lose their limbs or lose their eye, because of the effect of blood flow. And we know the effect of cholesterol is like lard that clogs up the blood vessels. And so we know the problems. We used to think one time ago that, oh, this is all in the mind. No, we know very clearly it is not in the mind. It is really in the body, and a lot of times, and the mind is just secondary to it. And so despite the fact that we have all these treatments that are available, especially with medications and surgery, that to treat men with this condition, here are the facts. About 90% of men never go to their physician in order to get treatment. And of the 10% that do go, it takes on average at least a year before they build up the nerve in order to go to the doctor to get treatment. So when you really want to see what is the prevalence of this erectile dysfunction in the country, don't mind the man talking, he can do all these sort of things and so on. Ask the partner. They'll tell you what are the realities. So there's got to be something more subtle to man's health other than the fact that there's something that's physical. There's some serious mental components to it. So let's look at this mental component, okay, in terms of, so what about this whole issue? You know, we say that health is a state of physical, mental, and social well-being, not just the absence of disease, okay? So this is one of my favorite pictures I like to show. And this is a picture that occurred on the highway in which there was a terrible accident in which the 4 men who were in the car, they died because of the accident. You can see it was raining, the road was slippery, and the men hit a lamp pole and they died. And they say that's a terrible accident. There's nothing accidental about this. These were 4 college fellas at a party. They were drinking. They're having a great time. The party started to get boring. They were told that there was another party a couple of blocks away, just off the highway. So they jumped in the car and they were speeding to get to this party on the highway, tried to take the curve, they skidded, and they hit the pole. There was nothing accidental about that. We could have predicted it. They were drunk. Shouldn't have been driving in the first place. They were speeding. Shouldn't be speeding in the first place. The road was wet. They were trying to take a curve. That's the nature of our men. We are risk takers. They just dared them and say, I bet you couldn't take this curve, making this kind of a speed. So there's something in our psyche. The facts of the matter is that prior to COVID, when we could really keep statistics, I don't know what the PMH is right now in terms of where we are, but, you know, we would see on average anywhere from 60 to 70,000 patient visits a year. Some 300 plus to 400 patients would come to the Princess Margaret Hospital accident emergency room, of which over a third plus of them would be because of some injury or trauma. And every day, at least one person would come into the emergency room in the Princess Margaret Hospital that's either been shot or stabbed. Those are the facts. The facts of the matter is that our men are very violent. And if you really want to see how violent they can be, this is an excellent book that was written by Superintendent Charles Hannah. It's online, it's free access. If you put it in and you can see, he's updated it. But at that time, in his first book, he looked at 5 years from 2005, 2009. We had 349 murders, of which 88% of them were men who were murdered. And practically 100% doing the murdering were men. And there has to be something in our psyche, because here's a photograph I got from Dr. Sands showing me, here's the guy, he's proud to show that he survived. Okay, so here it is. He had 3 gunshot injuries. You know, this was fantastic. Those were the dream. So we have to ask ourselves, okay, is this violent behavior just against other men? Yeah. We also know that we also violent against our women. You know, it's a very big problem in this country. I see Peter Nygaard, Brother Nygaard, not Peter Nygaard. Brother Nygaard just got convicted for his sexual assault. But it's very clear documented in this country that at least one out of every three men are being assaulted physically. And most of the time, the perpetrators are being the men. And this is the one which, again, has been highlighted in the introduction, is that this is a study from David Allen looking at the amount of suicides in the Bahamas from 2000 to 2013. I am waiting to see the update. But of the 96 cases of suicides, of which 55, half of them was by hanging, men were 7 times more likely to commit suicide compared to females. So just, so far this year, we've had a couple of men who have committed suicide. We even have where our high school children committing suicide. So this is a serious problem when we look at the mental health of our men in this country. So we have to ask ourselves, what is this mindset of violence and this violent behavior? Well, if you really like this topic, there's a fellow by the name of Michael Kaufman in Toronto has done a lot of work, and he talks about the masculinity and the triad of men's violence, because he says we got a problem in our men. They're not just violent against their counterparts, man versus man, but also against his spouse and his children, and also against himself. He said, so there's a common factor that we have to look at. What is the underlying pathology that's causing this? Because once we do that, then we can try to see how better we can improve the lives and the quality of living of our men. But that is a topic for another day. So at the end of the day, what I wanted you to conclude is that when it comes to men's health, we have a serious public health problem. And we define a public health problem as one in which it has these 3 elements. It causes a heavy burden on our society. Heavy burden in terms of morbidity, the injuries, the cost of care, and death, the pain and the suffering, not only of the individual, but the family members. Just imagine what it's like. I see Dr. Shea is on us. I remember one night they had a gang war in which we had I think it was 13 members got shot or injured in that night. We had every operating theater that was going in the Princess Margaret Hospital, all our consultants on duty. Do you know what the bill would have been like if they were in a private institution? Or if we really add up what is the cost of care for that night? Just look at it is what it costs. When someone comes in that has a stab wound, that goes into the hospital, that goes straight into the emergency room, that goes straight into the operating theater, use all the medications, and then they have to be rehabilitated. They're not paying into national insurance. They're getting from national insurance. Unbelievable. So it's a heavy burden on society. And it's preventable. It is, for the most part, preventable. And thirdly, it can happen to you. It can happen to any one of us. And so we take the public health approach. And once you put a disease within that category, you take that public health approach. And the public health approach is a preventive approach. We talk about primary, secondary, and tertiary prevention. So primary prevention is one in which we to say, listen, what is it like if we never had this disease at all? Can we just take it off the face of the map? That's what we do when we have a vaccination. So how many of us ever saw yellow fever? How many of us ever saw tetanus? How many of us see polio? We don't ever want to see it because we can prevent it right from the beginning. That's primary care. It never surfaces. And then you have secondary prevention. Secondary prevention is when you are a group at risk. So you identify a group at risk. For example, we know that if your family member, your sister or your mother had breast cancer, or your family member had prostate cancer, you know that you are at risk. So you get early checkup. Okay, so that is secondary prevention. So when you detect the disease, you pick it up at an early stage, and you can decrease the morbidity and the mortality. And then you have tertiary prevention, where you can do the measures where you have to treat it, but you treat it in such a way that hopefully you can minimize the morbidity or the illness or the suffering that goes along with it. So we look at this public health problem, that when it comes to men's health, we have a major public health problem in this country. And so we need to tackle it with a public health approach. And this is hot off the press. This is an article that was just published in the Lancet, which is probably one of the most prestigious English journals in the world. And this was just published in September 26. And this group from Germany, most of them from Europe, looked at cancer deaths in 2020. And of the 9.6 or practically 10 million cancer deaths, this article maintained very strongly that 70 up to 70% of them, anywhere from 50 to 70% of them, were preventable. And when we looked at those individuals that died, and you looked and said, okay, this person should have been, he died at 30. He should have lived until he was 40. So therefore, he lost 40 years of his life. So if you look at all the young people who died before 70, and you multiplied all the years they could have left, you come up with what is called the life years lost. So of this 528 million people that they felt that were preventable, we lost 183 million life years. And so put that in something that's tangible. Here is my 25-year or 30-year-old son or daughter. The evidence shows that in order to raise a child from birth until the end of high school, it costs some $250,000. And by the time you finish going to university and so on, now you near the $500,000 range. So you have just invested the best of your funds in raising this child. The society has invested in this child. You have invested in this child. Your family has invested in this child. And boom, at the age of 25 or 30, they died. Road traffic accident, gunshot injury, some gang warfare, drugs. And so what they were looking at, they found that of this, 3.6 million they felt could have been averted of these deaths by lifestyle changes. And usually lifestyle changes means exercising, better nutrition. Okay? These are two paramount things that stand up. Taking responsibility, getting your checkups in time, taking your medications that you should. And they could have had early detection. Again, preventable. Okay? And you had another 1.65 of them that were treatable, and they were never treated because the men didn't come forward to be treated. So when we start to look at a public health problem and we look at prevention, then we can appreciate the burden of disease in the society and how we are all impacted. And that is something that we have to go against. So you must ask the question now, so why are men like this? Well, we have poor health-seeking behavior. We don't go and get annual checkups. We are less likely to visit the doctor. We are less likely to know the signs of illness. Okay? Most of us go because women continue to press us that we should go. And we admit in ourselves that we've waited too long. We will not access the healthcare system. So, why are we not accessing the healthcare system? Well, there are a lot of us who don't know. There's equal amount that don't want to know. Some are raised not to know. Some deny that they know. And if they go, they go because they were not self-directed. And this was a very interesting survey that was done about prostate cancer. They in this telephone conversation called man, 68% knew someone who had prostate cancer. Not surprised. In our country, in our small country, it is very clear. I think everybody knows someone in their family or close friend or whatever who had prostate cancer. But half of the men, over half, say they never worry about getting prostate cancer. That if it happens, it happens. You got a quarter of them who said they never discuss prostate cancer screening with their doctor. Always another half say, well, we didn't know what were the warning signs of prostate cancer. And you can appreciate in prostate cancer in the early stages, in my last talk, that the most common symptom, and no symptoms at all. By the time you get a symptom, it's too late. The time a woman gets a symptom that she has cervical cancer is far too late. By the time a woman feels that she has breast cancer, it's too late. And of course, we mentioned earlier, they're uncomfortable with the idea of having a digital rectal examination. So it brings us to this issue that I feel is very much ingrained in our culture, whereby we say, I is man. I is man. And of course, the society says, you need to be a man. And our women say, you need to man up. So we must ask ourselves, so what does this mean? What does it take to be a man that can have these features? Well, the common statement that we have today, and particularly around the women, there's no real man left. Men have become too soft. They're getting feminized. So this is one of my favorite slides when I talk about men's health, because we ask that question, so what is a man? And I can tell you that 95% of the audience, be it man or woman, will tell you this is what a man is. He's responsible. He looks after his family. He provides for them. He protects them. He's the leader, and he's committed to it. Well, the problem is, I've got a son and a daughter. Is this not what we expect for our daughter as well? You have to question when we start to talk about what's expected of a man. Because it's the same thing I would like to have my daughter for, to be responsible and provide for herself if need be, and to look after protecting herself and take a leadership role and be committed to her own health and that of her family. But we know what a real man is. We don't need anyone to tell us. You know, you got to be aggressive. Can't be a wimpy guy. Real men don't talk long. You don't answer to anybody. Of course, when you have pain, you don't cry. You take risks. We talked about that. Or your sexual prowess now. You got to be a hard lover. You know how to make children. You know how to hold your liquor. When you're sick, you know how to bear pain. You don't go to a doctor, but you don't go together. You too busy hanging out with the boys. And if the wife gives you, the woman give you trouble, you touch up a little bit. And of course, you got to have a little side thing or two. But these are features that this is what a real man does in our society. And we identify with that. And we want to raise our boys just to be like us, bigger and stronger and better and faster and braver, aggressive, tough and strong. Because we want them to be like us. So what has happened really is that it's interesting. So from the time they hold up that first baby and they says, yes, this is a boy, we start a process. Your biological male society starts a process in which you are on the road to manhood. Let's just look at that. And we say, listen, this is how we want to raise our boys. We put them in a box. We got a set of beliefs in our society, and we put pressure on what it is to be a man and how a boy's supposed to be and how a boy's supposed to grow up and so forth. And we say, we put them in this box, well-described box. Yes, so we want you to be tough and competitive and have courage. Okay, and those days we say let the boys score, but the girls stay home. Okay, and if you don't conform to what we want of the boys, we say, listen, you're a sissy, you're a wimp, you're good, you're soft. Something ain't right with you. And then we only just don't only talk bad about you. We physically assault you. We tease you, isolate you, reject you, you get bullied. But if you have the features where you're very communicative, you have a soft and caring personality, and you tend to be emotional. If something happened, you cry along. Hey, no, sir, you don't fit into the box. You're basically kind of ostracized. Or they think about you kind of different. They try to zero you in into the other folks outside the box that are in the circle. And so from the minute you start, and we've got this program in our society. We start you off with the blue and the aggressive toys and get on the video games and the contact sports. And the girls, we do the nice, all in pink. Keep them in the house, you raise them, these are the things and so forth. So while this might be changing, by and large, this is our cultural norm. And so what we've got, we're raising our boys. The minute they, over the first 15 years, we really are raising them in a boot camp. We're teaching that men are strong and women are weak. And even if you don't feel strong, you got to show confidence in your insecurity. And even if you're hurting, you're supposed to be tough. And that men are superior and women are inferior. And women don't have the value that we have. And in fact, they are the property of men. They are sexual objects. You see it all the time inside all the social media and all the TikTok. That's what we see. So it's society itself that raising our boys in this way. And it's a toxic environment. It's a toxic environment. But just look at the conflict. On one end, we are saying, hey, we going to church. We got this ideal image of a protecting a wider, and we doing it every Sunday. But then when we go outside church, it's a whole different thing. We almost raising our boys to be schizophrenic. And so what about those boys that can't cope in that environment? The soft guys, the emotional guys, that don't feel they need to be tough and strong and so forth. They don't want to get into that group. All right? They get stressed up. They get angry. They get scared. They're confused. They might go into addiction. They get violent. They struggle. They become a pressure cooker. They get pushed to the edge. And so what do we find in our dropouts, violence, drugs, guns, premature death? That's what we see in our society. That's what we're making out every day. I had to slip this one in. We asked the question, so what about the women? Well, we've had the rise of the women power. The men have gotten left behind. There was a saying where the women were barefoot and pregnant and so forth. That image is gone. The pill came into being. Women could control I'm going to propose to you that women control their sexuality. And so they could stay in school. And they wanted to look after and do those same things that we said we wanted men to be. They wanted to take on that independent role and that leadership role and that commitment role and be a part of their family, not just bearing children and so on. And they helped each other. Again, this is a talk for another hour if I wanted to, but I wanted to highlight this for you because with this newfound sexual freedom and the whole feminist movement is not about women overpowering men. It's about women having equality with men, equality in education and employment and income and bedroom and elsewhere. And so what do we see the outcome of that? Well, just look at the graduating class at the University of the Bahamas. 3/4 of the graduates are women. I look at my medical school that we have, and what do we find in the last 25 years? Of the 600 plus graduates, 80% of them are being females. And so it's not surprising now that in the country, there are more women that are employed than men. So when we start to look at what is called the social determinants of health, we have to appreciate that your disease does not necessarily occur because you have an organ system that went bad. It might very well have been that the societal norms and the society organ systems have failed, or they have been construed in a way not to our benefit, or we're not using them as men. And that's where the illness comes from. This is a major problem when we look at men's health. So we can't just look at it in isolation and say that, listen, we can cure gunshot injury. I can do that. Hey, guy, I'm fantastic. You come into the hospital, you get there in time, you get you in the operating room, even though you don't have any money, and you walk out a couple of weeks later. And more men come and we get better at it. But that will not cure the guns on the street. No matter how good and how much money you spend in the hospital. So we got to have a different healthcare system to tackle that problem outside. So where do we find solutions? Well, we need to look at this whole situation of how we raise our voice. Because I said this is a very toxic process that we are producing, what we want to see in our men. So we need to review it. We need to deconstruct, okay? We need to revise it. And we need to redefine what it is we want in our men to produce productive, healthy men in our society for a better society and better partners for our women. And so we need a safe place for men. We need a place where men can get together. See, the problem is the only place where men get together and talk is what today? Today is Tuesday. Okay, good. This last night was football Monday, and then they'll be on Thursday, and then Saturday and Sunday. So when it comes to the football games and the baseball games and all the men get together. Oh, we can tell you the best player is, the best quarterback, and the best back. We can tell you all the good sports and stuff. But we don't talk about us. We don't talk about our problems. You know, there's a story of these three close friends who went to high school together, went to college together, and they go out on the weekends and enjoy party and so forth. Close, know everything about everyone. And then one of the guys committed suicide. And the two guys were shocked because the fella never talked about the problems he was having at home. He never talked about his ability. He couldn't get his erections the way he wanted to, and he couldn't relate to his wife. And he felt that he was incompetent. He felt that he was less than a man, and he couldn't live with this anymore. So who does he talk to? Because that's not what men's supposed to do. So where would he go? When would he go? Who would he talk to? So we need a safe place where men can feel that it is safe for them to talk, that to express their vulnerability, would they, their doubts and their confusion, and try to understand, what that women are complex for us to understand. And worse still, it's like how to love a woman who knows exactly how to be loved. And we are not performing. I suggest to you, that's why we drink the way we do. We're not measuring up to the mark, be it on the job, be it the income, be it in the bedroom, be it in raising our children. We got a serious problem, which is affecting our mental health. And these are all direct aspects of our social determinants impacting our health. So we need that so we can get a better hold of ourselves. We can work together, raise our sons and teach them to be men, not dominating, that they can express their feelings and emotions. Yes, something affect them. They can share it there. We shouldn't be in a situation whereby we are saying, look at that man cry. This must be a terrible situation, because men are not supposed to cry. Okay? And so, we got to challenge them. Okay? It is tough not to be hard. It is tough to show the vulnerable part of your personality. It is tough to be emotional and don't feel less of a man. And, we need to look, when we deconstruct, we say, yes, there's some very positive things about being a man as well, which differentiates us in our personality from Men express love differently. We weren't raised to express that love emotional. But men don't think 1 minute when it comes, if there's war, the other guys line up and they ready to go to war. They ready to go and be killed to protect their family, their children, their wives, their spouse, their community, to sacrifice and protect. Those are good qualities in men. And they will be persistent. They will persevere until the job is done. They'll be much more decisive in terms of solving problems. Okay? Courage. These are good features. To be men of good character, noble character. These are positive aspects of manhood. Okay? And finally, we come through as, there's more to, I don't like to use the word health anymore, where we talk about the state of physical and mental well-being and not merely the absence of disease. I think the new word in our armamentarium and our vocabulary with health should be wellness. They talk about the department, they talk about the Ministry of Health and Wellness, but they really haven't emphasized what wellness means. Wellness, by definition, is a lifestyle approach. So in other words, we have to change our whole behavior. It's not to say, okay, good, Christmas coming, so the minute I'm going to eat all I want, and then good, when January comes, I'm going to do a little exercise and stuff and get this off. No, it's not just a one-time thing. It's a lifestyle thing. And we continue doing it. It's an approach to the pursuit of the best health that we can get it. And what are the pillars? Okay? We want to make sure that we have the lifelong discipline on the piece of excellent health. Proper weight, proper diet, proper exercise, proper rest, proper attitude, because really, those define the pillars of wellness. Number one, personal responsibility. It is your responsibility as a man to look after your health. Your wife. It's time to get your checkup. It's time to go to the dentist. It's your responsibility. You shouldn't be looking to your mom to do that when you're 60 to tell you what you need to get done. It's your personal responsibility to look after your health. Your nutritional awareness. You need to say, listen, I got to eat better than this. I can't look at my weight. This doesn't work out right. Because we know what obesity and overweight does. We know physical fitness. And let me tell you, the evidence is very clear in prostate cancer. It comes out even more today that men who are physically fit, they attain the nutritional status that they had. They are less likely to have prostate cancer. And if they had it, they're less likely to have recurrence after they treat it. And if it comes back, it's less likely to progress. There is no argument in that anymore. That is clear. We got to manage our stress. We live in a very stressful world, especially if you live in a house where you got one house here and 4 and 5 houses over there. And you got to have, you got to have kids that you have to look after. It's one thing to have one kid in the house and 5 and 6 kids after. These are serious things. Very stress element. You just don't make enough money. Yeah, and of course, we have to look at our environment. Not only, there's the immediate environment, there's us getting involved in our neighborhood watch. Then, of course, we have the whole environment of climate change and its impact with us. Another couple 100 years, half of the Bahamas might be gone. And so we need to redefine what we want to be in a man, what a real man is. We need to look after bettering our health. We know the things we need to do to better our health. We know the checkups we need. We know the 5 pillars of wellness. And we must commit to it. Okay, we need to respect and honor our spouses. We need to become financially responsible. We need to plan the amount of kids that we want to have. You can't have kids all over the place. And the fact that you might have come, you have to be an example of who you are. Yes, you might have come. Listen, my daddy said he had more than 15 kids and he refused to believe it was 15. He said, that's it. No one else. I was meeting members of my families when I was 30s and meeting them for the first time. My daddy never saw me in bed sleeping. He never read me a story. So I said, listen, I might be the best guy in the world, but I tell you one thing, I'm going to make sure that every kid I have, that I could see them go to bed at night. I could read them a story. I can check their homework. I come home late. I can go and open the door and I can see them. They only got 2 kids. So you could change the paradigm overnight and make that commitment. You got to have your community service. Got to be a part of the crime. And you got to have mentorship, because there are a lot of boys, to talk about the one-parent family, particularly the parent family, where we have 60 and 70% of our homes with one-parent family. When you look at the data that comes out in these one-parent family, predominantly by women, it's terrible. In terms of the increase in prison, in terms of the increase in drug use, in terms of violence, in terms of domestic-based violence. So we know that there are a lot of boys out there that are hurting, and they need to have a surrogate father. We got to mentor them. We got to dismantle this violent behavior. We've got to be able to say that, yes, you need to vote and pay your taxes and on our symbol. This is what we want to redefine as a real man in our society. And so I thought I'd give you a different perspective of looking at men's health. When Dr. Shea asked if I would do it, I say, yeah, this is great, because what I want to do, I want to give them a different perspective in terms of the way I see men's health in the Bahamas, and share my views. I go about, and I've been very consistent and very persistent in terms of how do we better the health of men in our country. And I think that it goes far beyond just looking at what my clinical statistics in terms of my blood pressure and my sugar and all that. That's important. But we got a serious component of mental health, and we got a serious component of how we raise our boys within our culture, our social determinants of the disease. We've got a serious problem with regards to men's health. It's a public health problem, and we all need to be involved. But more importantly, we've got to really get our men and find a safe place for them to appreciate the magnitude of that problem, and for them to be very instrumental in the ones who are to make themselves better. So with that, I hope I didn't take too long and ramble and tell you some of the way I look at men's health. It's a little different approach, but then that's what it does after you've been around for a couple of years, and you can see what happens to the men in our society. When my men come with prostate cancer and I make a diagnosis, I refuse to talk to them about it. I insist you got to bring your spouse, bring your family, and everyone, so we can have a family discussion about your condition. I've seen too many men where when they do finally collapse at home, and the family says, "But doc, I didn't know he had cancer. He never told us. We never had this problem before." I look all the time, and it's amazing. Women get breast cancer. You will see them. They got their picture. They have no problems going in the newspaper, going on TV, going on social media. I had breast cancer. This is what I do. This is what it. You don't see that many men get up and say they had prostate cancer. We've been struggling with our men's support group, us too. All the men that we diagnosed with prostate cancer, very hard to get 5 or 6 of them come to a meeting. That is where our problem is. We've got a serious mental social problem. That's where we have to put our effort. So now let's listen to any questions you have to ask me.
Hi, Dr. Roberts. Great synopsis of men's health. Great information on the situation in the Bahamas. Thanks for agreeing to give this talk. You are the most appropriate person to give this lecture. Thank you. That was from Dr. Shea.
Thank you, sir.
It says, I always say a lot of our talks, research fall on the wrong ears. How can we tell persons in power, public health, the sad truth of the information you presented? We seem to be spending resources in the wrong areas, priorities. I think much of our little money we have is not spent wisely. But as we know, health education is a difficult task. Changing behavior is difficult. We need to increase men's health information health information. It is on the back burner. Women health definitely more in the forefront. Look at the numbers at this talk compared to a breast cancer talk.
That's right. But I want to differ and say this. One of the first slides that I showed you was that in the past 100 years, we have increased our longevity, double it to people living in their 70s and their 80s. We have done that on the basis of advances in medical care. It did not come cheap. Medicine today is very expensive. You can't run away with it. And if you want good health care, you have to spend money. You have to spend money. Someone has to pay for it. And if you have a little bit of money to spend, then you will have a little bit of care. You have to accept a little bit of care that you have. Now, what you have to determine is how do we collectively as a society decide that we are going to fund the health care? That's where the rubber meets the road. So when you reach a place like, when you look at the different ways of paying for the health care, the first system in the world that started was in Germany from in the 1800s. They collectively, independent of the government, got their equivalent of unions, so to speak, their guilds, the occupational groups that they had. They put in their fund so that when they got sick and couldn't work, they were helping each other. And as a result of that in Germany, their healthcare system evolved in the private sector so that the government's contribution for the health fund and health care has to do with providing for the indigent, those who are least able to afford, and to regulate the system. So they have one of the best healthcare systems in the world. The country collectively pays for it. Britain came forward and they had a different system. What they said is, okay, we collectively pay for their taxes. And so in 1948, they came up with the National Health Service in Great Britain. And unfortunately, nowadays, they begin to realize they need to spend more money than what they're spending now because COVID just really broke their backs. So you realize that as time goes on, healthcare becomes more expensive. You got to put more money in it. So you collectively, as a people, need to determine how to do that best so that everyone has the same quality of care. Do you believe that we are brothers keepers? Do you believe that health is a common good, is a public good, that everyone must have equal access and availability of health care? Or you could be like in the Canadian system, where again, they have decided that they will have a health insurance type where the first level of care in terms of what they call essential care services, they are paid for everybody. No one goes bankrupt because of health care. They don't have to go looking to see where I can have fundraising, GoFundMe, another cookout. Going more than half of the bankruptcies in the United States are because of health care. You'd be surprised. That's another talk one day that we can have when you look at the financial health care, the toxicity. What it costs. You know how many people go bankrupt? How many people they have to take their kids out of school or lose their houses? Okay, so when we start to look at health care and we decide what is the quality of care we want as a people, and we will afford to pay for the health care, because that's what we have to do. So my perception or my concept of health care is that there's no such thing as health insurance. I don't believe in health insurance because insurance, this is my opinion from my reading, insurance is a misnomer when it comes to healthcare. Because if you look at what insurance is when we collectively pool our money where the risk of something happening is very small. And so we don't have to put in much money and we have a nice pool. So therefore, you insure your house, but the risk of your house burning down is very small. You insure your car, but the risk of your car, mashing up your car is very small. But when you look at healthcare, risk as to you getting sick. My brother, you will get sick, and when you get over 40 and 50, you'll get sick plenty times. It's not a matter if, it's when. So healthcare should be a mutual. Everybody makes a contribution. It's like how the ASU is. everyone makes a contribution. Everyone puts into the pool. And so the time will come when you get your draw. And so when you put in earlier, you have more to draw from as you get earlier. That's what the Medicare system in the States is like. You put in your Social Security, you put in towards your health care. So when you reach 65 in this country, you pray you're gone. You can't afford health care after that. They kick you out. Too expensive. In the United States, it's reversed. They pray to get 65, because now they get Medicare. They get health insurance when they need it. So we collectively as a people need to decide, listen, how are we going to fund health care? It isn't that the government has little money. Health care is expensive. Full stop. People want good care. When you go to the hospital, you need to have a CAT scan. You need to have an MRI. You need to have good surgeons and good nurses. That don't come cheap. So when you have a little bit of money, if you're paying peanuts, you got monkeys. You got to realize that healthcare is expensive in 2023, and the government must take a position that they will fund it, and funding goes beyond just saying, I got a pretty building, I got a pretty looking hospital. It's much more than that, much more complex than that.
All right, we have another question.
Get me, Robin, or there's a whole, I get a different perspective when I start to talk with
Dr. Roberts, can you briefly discuss the PSA levels at various age and when a man should become concerned?
A very good question. The first thing you must realize is, what is PSA? PSA is a molecule or chemical that's produced solely by the prostate gland, for all practical purposes, solely by the prostate gland. Prostate-specific antigen. So a molecule only by the prostate. Now, it's produced all the time by the prostate. But when the prostate becomes cancerous, it produces 10 to 30 times more PSA than before. So therefore, we have a baseline of PSA that a normal prostate would produce. And then when it becomes cancerous, we'll see that that PSA spirals. And so what we've been able to do is we've been able to measure that and say, so what is the normal PSAs? And does the PSA change as men get older? And what have we found? We find that the thing about PSA is that it's a good test in the sense that it's the best test we've had so far. But the problem is, it's still a terrible test. It's still not a good test. Number one, we know it's produced only by the prostate. But as the prostate gets bigger, it makes more PSA. And the prostate gland is a very special gland. It's the only thing in our body when we reach the age of 40, it starts to grow and it never stops growing. Continues to grow. Some it grows more than others. So what you find that as what is considered normal, what is normal in the 40s will be a little more in the 50s, will be a little more in the 60s. So you had to be very important. So we look at the fact that the most common cause for PSA that starts to rise is just a man having a normal big prostate. It's not cancerous, so we say it's the benign prostate enlargement. The second thing, the prostate works, it makes juices. It works when we have an ejaculation. Every time you ejaculate, the PSA goes sky high, and it takes 2 to 3 days to come down. So you got to say to the man, if you're going to get your PSA done, you should have no sex for at least minimum of 2 days, ideally 3 days. Then get your PSA. You get an infection in the prostate. And that infection has nothing to do with getting sexually transmitted disease. The same bugs on your skin. Yes, they got the bugs on a woman's skin, and particularly in that area below, can get into the vagina. Doesn't cause any infections, they live there. Well, the bugs can get into the prostate through the urine passage. And when they get in the prostate, they stay there. And you don't feel anything. You don't know they're there. And sometimes they multiply and doing a little something. So you got this very benign little inflammation going on in the prostate. And how we know that? We know that because when men die and we have a look at their prostates, we find all this inflammation in the prostate. They never had any complaints. And that type of problem causes your PSA to go up. You can have the urine, any infection in the urinary system cause the PSA to go up. If the doctor examines the prostate too hard, that causes the PSA to go. If there's any manipulation of the prostate, right, that causes the PSA to go up. So quite a number of things can cause the PSA to go up that has nothing to do with cancer. That's why it's not a good test. We say that its specificity is not good. It's not specific for prostate cancer. Now, the higher it goes, the more likely it reflects the prostate cancer. What have we found? We found that if you use the baseline where 4 is normal, and you realize 4 is normal, but that's average, because in the 40s, the upper limit of normal should be 2. In the 50s, it should be 3. In the 60s, it should be 4. But we use 4 as the magic level. So when you use 4 as the magic level, you say, okay, good. Between 4 and 10, the PSA is starting to go up. So you get concerned. But what they have found, if they were able to take out all the prostates that were elevated and see, what's the chances of getting prostate cancer? Only 15% of them between the levels of 4 and 10 will have prostate cancer. So 85% of the first elevation of the PSA has nothing to do with cancer. And so it's very important for the medical practitioner and to explain to the patient that if the PSA is elevated, don't get excited. It doesn't mean you have cancer. Now, when you see it get over 20, now the likelihood is the PSA going up. Now, we have many different forms of PSA, so that when it goes up to tell us that what's the likelihood that this PSA might be a cancer, this elevated. So over the last couple of years now, the MRI has been advanced. So we now have an imaging test, which the ultrasound was not good at. So we can look at the probability when we do an X-ray of the prostate through the MRI and the new machines that if we detect something, you got an 80% chance that is a cancer. So now we are on the verge where the MRI for the prostate is becoming the new standard of care. Now look what that means. That means one time ago, I could have just examined the prostate, get a doctor visit. I could just do a blood test, cost me $70, $80. Now they tell me if that's abnormal, the next test I should do is an MRI. That's $1,000. So we got better care. So when you only have a little bit of money, how in the hell you can get the better care? That's the advances that you make, because these new machines don't cost $10. You're in the $500,000 and $1 million range. Plus, you got to have the experts who know how to manage it, and you got to continue to have supplies. That's the reality of healthcare today in this age. And so that's the whole issue about PSA. The doctor needs to sit down and discuss your PSA results, what it means, how much concern you should have, what is the next step. But to realize that in most instances, and particularly now, that we are getting the men to do their PSAs early. So we expect if we find prostate cancer, we won't find it when the PSAs is under 10 or under 20. We don't want to find it when they come in the thousands. The men come in my office with PSAs for the first time in the thousands. You don't want that. And so we have a new term that we use. I'm sure they use it in breath. It's called shared decision making. So the doctor needs to sit down and talk to the patient. Say, here are your options. These are the ways that we need to go. Here is the benefit. Here is where there is no benefit. Here is where we get the best bang for our bucks. And that's. I hope I give you a better understanding of the PSA and what it means. But you can't take a reading in isolation. The only other thing I want to say now is that there are two aspects of PSA. There's the PSA in making the diagnosis of prostate cancer. But that's not what PSA actually came about initially. PSA came about initially so that if you are diagnosed with prostate cancer, if you are treated effectively, your PSA is 0. Now that's the most accurate thing in the world. If you are treated with prostate cancer and you've gotten rid of the cancer, your PSA should be 0. So if you went and you got a prostatectomy and you took out your prostate for prostate cancer, if your level comes back at 0.1, you got cancer. It should be 0. So the real accuracy in PSA is monitoring to see, does it come back? How high is it? How quickly is it rising? So PSA has become a very important part of our armamentarium with regards to not only diagnosing PSA, prostate cancer, but and the response to treatment. So yeah, I spent a little while, but PSA is a very important topic. I'd like people to get a better understanding of what it is and what it means, and that decreases the anxiety considerably.
Yes, that was a good explanation. And you really break it down so we could understand and not use all those medical jargons where the average person don't know those medical terms. You break it down like real talk.
We didn't have
Simple.
to Google after you told us.
Thank you.
Well, I don't know. There are no other questions in the chat, and I don't know if anyone has anything else to ask or add comment. But I would certainly like to say, Dr. Roberts, that you know, we obviously saved the best for last. This is our last presentation for the year, and I can tell you it has been a very different perspective, a very passionate presentation on your behalf, and we can tell that it was on something that's very dear to you. And I don't think anyone who joined in today expected a presentation from the point of view that you brought it. You certainly nailed it from my where I'm sitting, and I want to thank you very much for your presentation. Like Erin said, everything was in very relatable terms that we could all understand, and we could all have taken something away. Don't forget, Love Lights a Tree. We'll see you. That'll be not this Friday, next week Friday, out at the Mall at Marathon. Thank you.